Hi there, my name is Jennifer, and today's discussion will be about hand, foot, and mouth disease. Hand, foot, and mouth disease is actually a virus caused by the enterovirus, and it is extremely common and very contagious in school-age children, especially those under the age of 5, and for those that go to preschool. You'll see an increased prevalence around the end of summer, early fall, as school starts going back into session because of increased exposure and new bodies. So there's an incubation period for this virus, so about 5 to 6 days, and symptoms will actually present much like the common cold: sore throat, low-grade fever, coughing, sneezing, runny nose. And then a few days after that, a rash will present in the form of blisters, and this rash will show up inside the mouth, on the palms of the hand, soles of the feet, and along the back and the buttocks. The blisters look worse than they actually are, so try to reassure parents that it's okay, and the rash will go away and all this will go away in time. So the most concerning part of this virus is the potential for dehydration because of the oral mouth blisters. The child is often too uncomfortable to eat and therefore risks loss of fluids and nutrients and vitamins for a couple days. So what can you do to help these families? Well, first of all, you can point them in the direction of the over-the-counter analgesics like acetaminophen or ibuprofen, and these will help with the general discomfort, any fever, and of course the pain that's involved. I personally like to recommend Pedialyte popsicles because they provide a numbing effect, to the mouth because of the temperature, and also you pack a punch for some hydration. Try to steer parents away from using any home oral mouthwashes or hydrocortisone cream or anything like that for the rash, because these actually don't help and can further irritate the symptoms. Pay attention to prescribers sending in prescriptions for magic mouthwash. Usually the components of this magic mouthwash will include antacid, liquid antacid like Mylanta or Maalox mixed in a 1:1 part solution with viscous lidocaine and liquid diphenhydramine. So this is mixed up, and then usually the parent can administer, either if the child's old enough, administer a teaspoon for the child to swish and then spit in order to coat the mouth sores with the medication. Or if the child's too small, just advise the parent to use an oral syringe or a Q-tip, and they can actually administer the mixture directly to the oral blisters themselves to help give some relief so that the child may eat. Recommend administering about 20 minutes before mealtime, just to let the numbing effect set in and for the Maalox and diphenhydramine to coat and soothe. So just encourage parents of these patients that time itself is really its only cure, and symptom relief is the way to go. Thanks, and have a great day.